So when talking to my colleagues and my coworkers who are every single day kind of working with people who are walking through their substance use disorder, this video, as I said before, really is one of the better examples of ways that we've shown it to parents for adolescents, and that's been really eye-opening for a lot of them. It just kind of can give a little bit of a picture of what it looks like to the person who's going through that. Are there any other thoughts or comments that you guys would like to share before we move on?
So even though the body got hurt more and more, it didn't matter to the person.
Mm-hmm. Yep, which leads to this idea that addiction is a brain disease, right? So it changes the structure of the brain, and that changes our behavior. So it's not just you're a bad person if you are have a substance use disorder. It's a disease that literally changes the way your body and your mind thinks about everything you do. Great. So the next question is how can we possibly help, right? So what are some ways that maybe you would approach someone where you're concerned about their well-being? What are some things that might stick out to you?
Maybe a special birthday card or something that just says, hey, if you need help, I'm here.
Yeah.
Just a little reminder.
Yeah, that's a good one.
Sticky notes on a mirror.
Absolutely, for sure. Yeah. Anybody else? No? Well, there is one thing. So we call this a screen. And in this example, I wanted to kind of share a little bit about this is the CADC. It's a screener that the American Addiction Center uses to identify if there's maybe some concern about someone's alcohol use. Okay, so CADC is a acronym that stands for cutting down annoyance by criticism, feeling guilty, and then eye openers. So this is one very simple set of 4 questions that you can ask either yourself if you are questioning whether your substance use is possibly a problem, or someone that you care about. So the first one is, have you ever felt that you should cut down on your drinking, for example, or your marijuana smoking, or your whatever substance is at question here? And if your answer is yes, that's 1 point. If it's no, it's 0 points. Okay? The second question is, have people ever annoyed you by criticizing what you're using or how much you're using? If yes, 1 point. If no, yes. No points. Okay? So you kind of get the idea how at the end of this, if you have a minimum of 2 points, that may be cause for concern. Okay, so that's what they call is clinically significant, in that you might want to connect with a professional counselor to possibly be assessed a little further. Because obviously these are only 4 questions, so it's really not a big picture as to how the substance use is impacting your life, right? So next, I wanted to go over the signs and symptoms of addiction. This is using a clinical diagnostic manual that this is done and determined by a licensed counselor, okay? So there are 11 criteria that are being assessed when one comes for questions related to substance use. So one of the first criteria is taking the substance in larger amounts for a longer period of time than you intended to. So we'll continue to kind of use this idea of alcohol because it's legal. Lots of people use it in general, right? But if you notice someone is drinking more for a longer period of time than they maybe wanted to or they expected to, that could be cause for concern. But just note, that's just one. That's just one thing, right? A second criteria is wanting to cut down or cut back on how much you're drinking, right? So these are common things that we all do. You could apply this even not just to alcohol, but to sugar, to snack foods that aren't necessarily helpful or healthy. So anytime you think about, oh, I probably shouldn't have that second beer, like that kind of, it's probably not good for me, or I shouldn't have that third piece of pizza, or whatever. So thinking something like that, thinking that maybe I should cut back. Next, spending a lot of time or effort getting, using, or recovering from the use of a substance. So if you're going out to the college football game and you're having a couple drinks, and then the next morning it's really, really, you have a bit of a hangover maybe, and it impacts your ability to go to church in the next morning, right? So as you're recovering from that football game that you got to watch, your substance use impacted what you're doing the next day. Okay? Cravings or urges to use the substance, where you have these thoughts in your mind that are like, oh, if only I had, oh man, I wish I had this or that or the other thing. That's another sign or symptom of addiction. Not managing to do what you should do or are required to do. So if you have a job, or if you are required or expected to do certain things around your house, if you're expected to go to school, all your responsibilities. So if you're finding that you're not doing those because you are out looking for your next six-pack of whatever, or you're, in the case of a lot of adolescents, they're out trying to find, because they can't technically buy it, so they have to find people who can and figure out ways that they can access it, right? So these are just a few of the criteria that are discussed in the context of an assessment. Some others are continued use despite it causing problems in relationships. So strains on relationships, especially between partners or spouses. Hey, like, I wish my husband just wouldn't have as much as he drinks when he's watching the football game, or it creates tension in that relationship. Or maybe you are trying to quit smoking yourself, but your significant other is not, and so they're smoking around you, and that's creating tension in the relationship. So see how addiction can impact our relationships as well. So this is another sign that even if you're not a licensed professional, you can kind of start to notice some of the behaviors and things that can impact day-to-day life, right? Next is giving up on social and occupational or recreational activities. So again, these are things like maybe you used to love going golfing every weekend, or you like to go hiking, but now not so much. You're staying home so that you can do whatever it is that you're doing instead. A lot of times you find people isolating themselves because they don't want to be seen using as much as they are, so they'll withdraw from social or family gatherings. And that can be another thing that you can kind of just ask yourself, right? Next, using substances over and over again, even when it puts you in danger. So this is, again, situational awareness, understanding, especially if you're getting in the car after going to the bar. This is a situation that you're putting yourself in danger over and over again. So the use doesn't seem to stop you from making the choice of putting yourself in danger, right? We also see this a lot with adolescents, teenagers, because, well, one, their brain is still developing. Our brains don't fully develop until we're 25 years old. And so as their brain develops, and then they also are using substances, this can impact that development. It can stunt it. And so they're already oftentimes are more likely to be put in dangerous situations, even if they're not using, but then you add in substances and that can really increase it too. All right, continued use, even if you know that your use impacts you in either a physical, psychological, or mental health way. So for example, if alcohol is a great example, if you have a co-occurring medical diagnosis of maybe diabetes or hypertension, because those are all things that alcohol can make those things worse, right? Or if you have depression or anxiety, marijuana, alcohol. For some people, if you use it, it can increase your anxiety to the point of paranoia, for example. And in the case of depression, it can impact you that way as well. So next would be if you find that you or your loved one is needing more of the substance to get the effect that they're wanted. So in the little video, so we noticed how he ran to each of the little bits to try and get the same effect. So this is a building up a tolerance where you're noticing that, your 3 beers is not hitting you the same way. And so let me try 4 so that I can get that buzzed feeling. And then lastly is the development of withdrawal symptoms, which only go away when you use the substance. So a combination of any and all of these can create a mild, moderate, or severe diagnosis of substance use disorder. Does that make sense? Okay. So these are all kind of criteria that are intimately linked to our behaviors, right? So the use of substances is a behavior, and the things that it makes us do as a result also is a behavior. For many of us, it's a very personal topic, right? Like I said, those ripple effects, it's not just about the people who are living with this disease, it is the ripples that impact all of us, right?
It's not just about addiction, it's about the emotion behind it.
Yep,
it's about the
there's a
emotion
lot.
behind it and the emotion behind it. Empathy, we gotta have empathy for those people,
For sure. Yes, absolutely, well said. Thinking about this idea of as community members, as people who care about their community, right? And those we care about, we want to look at what can we do, right? So whether you are currently living with a substance use disorder or you know someone who has one of the hardest things is how to support them, right? How can I show them that I love you? How can I show them that you matter to me so that we can reconnect? This idea of connection and changing the environment that our society has kind of created over time. What can we do? So I'm a very practical person, so I'm going to give you guys some very practical things to kind of start with, okay? And I got this resource here from the Substance Abuse and Mental Health Services Administration, and it's on the back table there as well. So it's a handout that they created on how to start this conversation about substance use.
Is she right here?
Yes. Okay. Yes, well done, you have it. So it has very nicely laid out 5 steps, right? So I'm just going to kind of go over it with you guys because and you can use this both with substance use if you have concerns or with someone who's struggling maybe with their mental health as well, okay? So the first thing is to identify a time and a place to connect with this person. So where do you think is best to connect with someone? Is it in like the checkout line at Meijer?
Church.
Could be church, that's a good one. Not at Meijer? No? Good.
Over the phone.
Yeah, over the phone could be helpful. Making sure you know where the person is, right, on the other end. So finding a place that's maybe private, that's quiet, and then asking permission to have a conversation with your loved one, right? It seems really simple and kind of obvious, but I don't necessarily know that we all do it that way, right? Oftentimes it's in the heat of a moment, they're in the fridge grabbing another beer possibly, like whatever it is, and you're just like, that's it, we need to talk, and maybe that's just not the time, right? So it's identifying a time and a place to have a conversation, right? The second one is to express your concerns and to be direct. Don't go around the issue. Well, maybe, what do you think if, I'm wondering if, just be like, hey, I'm concerned about you. I noticed this, and this, and I want to know how you're doing with this. I have fear. You can express yourself through the emotions that you have regarding what that person is doing, But being direct about that and expressing yourself can be really helpful. Okay? So they have some good examples on the side there. I see you're going through something. How can I best support you? Right? Sometimes we go to things like cannabis or alcohol because whatever it is we're going through right now is just really hard and we need a break from it, right?
This is your time for that person.
Yeah, that's a great thing to do too. And then acknowledging their feelings is number 3. So being able to listen and not come at it from a point of, you're doing something wrong, you're making me feel this way. It's no, how are you feeling, right? It's
Validate them.
Ask them, like, what's going on? Is there something I'm not getting? Am I not supporting you in the way that is most helpful? Like, be willing to ask the question, but then listen to the answer. Because this might be the first time this person has ever been asked this question, has been told that, hey, I'm concerned about you because of A, B, C, right? And so they may not have the answer right away, right? And so they may need to think back and maybe talk it out a little bit. So you have to be willing and able to listen to their answer, right? Number 4 is next to offer help. Provide reassurance that you're there for them, that you love them. Provide some, hey, like we have community-based services that can help us with this. Professionals who their whole entire job is to support families and individuals walking through this. And maybe it turns out to be, you have a couple of sessions and you know what you need to do and you're done. Or maybe you need a referral to, maybe you haven't been diagnosed possibly with an anxiety or depression diagnosis, and maybe that's something that maybe you have a chemical imbalance or something where connection to a provider might be helpful. So it just depends. But being there and offering support to help them get the help they need.
Try to put yourself in their shoes so you understand how they feel.
Yeah.
That's the difference between empathy and sympathy.
You're right. Yes, absolutely. Absolutely. And then 5, again, seems very simple, but being patient, right? Recognizing that the behavior, the issue that this person has caused your concern did not happen overnight. It's usually a long time that it kind of snowballs into something more, right? Does anyone have any questions about this handout? Does this make sense? Yeah. So this is just a way to get you kind of started with the conversation. Obviously, everyone is different. And luckily, you coming to that person as a loved one is going to be really helpful because there's trust that's already built there, right? All right. Next, when we're looking to provide support. So this is when you talk to your loved one, right? You start the conversation and the conversation continues, right? The door has been opened and now things are happening, right? So the first thing to kind of notice, and there is another handout from back there as well from the Substance Use and Mental Health Services Administration. So it's this one. It's got a nice little circular infographic there. The first thing to realize is to provide hope for that person. Because a lot of times, because of what we think in our society about substance use or mental health, that it means you're bad, it means there's something wrong with you. These things are treatable. We have a lot of evidence to support treatment that it works and that people can get things under control with the support and care that they need.
Provide a healthy, safe environment for them to heal in.
Absolutely, yes. And part of that is that connection piece. So there's only so much that professionals can do, right? So we can provide the counseling, we can provide the tools, the toolbox. However, it's the day-to-day life outside of that 1-hour therapy session a week that life happens, right? Because there's still going to be stressors, there's still going to be questions, there's still going to be difficulties, there's going to be some great things as well. However, when you are doing life together with your loved one, that can make a really big difference. And so that's why I wanted to start talking about this, is because one, you need to know that this is treatable, that there is hope, that things can progress in a good way. Two, that there is hope, there is support available for you as a support person, right? So there is a community helpline that is available. And also on that back table, I provided a whole bunch of helpful resources. And I love that you brought up this idea of a book. So there's a couple books that can kind of help, if that's something that's of interest to you, to kind of talk about what addiction is in more detail and in different ways, so that you can feel like you have the education that you need to be able to support in the best way. Okay, there's also just a lot of websites that are available as well. And just ways to educate yourself. Another thing that I would encourage you with is there's a lot of support groups, not just for those that are living with the disease, but also those that are helping to care and support them. And so that's on the second page, the back of the first page. So there's a bunch of support groups that you could check out, and these would be with people who are also supporting loved ones, right? So that is a resource for you guys to have in case you feel that that would be helpful. And that kind of goes into the one on the bottom here, is that says, be sure to care for yourself. Self-care is very, very important when you are supporting someone going through a chronic long-term diagnosis, such as a substance use disorder or addiction. When it gets to the point of addiction, it's a pretty significant deal, okay? Next, to continue to show compassion, both for yourself as well as for your family member or loved one. And to really be able to look for and interact with the treatment services as you feel would be helpful. So at least I can share for at Wedgwood, we love working with families. We love educating parents, important people that are in the lives of our clients. Because again, you guys are the ones that are doing the work most of the time. Because you're the ones supporting them. You're the ones who are picking up the pieces when they stumble. We get to unpack things and clinically analyze things and really provide tools that can help for next time. But during the days, we're not there to walk, with your loved one. We're there probably by phone, but it's not something as easy as, hey, sweetie, how was your day today? How did work go? Is there anything that was stressful that we need to discuss tonight? Like those are, those conversations that you can have on a day-to-day basis that can really provide that connection that person is really looking for. All right, and then the last one that I think is also very important is called Be Open, and this is to discuss, especially if this is a loved one or a family member, be open to discuss family history of either mental illness or substance use disorder, because there are some genetic factors that are connected to this. And so this will just let your loved one know that they're not alone, that they're not weird necessarily. There's nothing wrong with them, but that they need some assistance. Really providing them with, again, that hope, that connection, not to isolate them. We're trying to bring them back in, because oftentimes people will self-isolate. All right. Just some special considerations for you as we kind of conclude here, and then I'll have time for questions. When it comes to caring for those with substance use disorder, or just someone who is who needs that extra support, these are two things that I want to make sure everyone, when you leave today, you consider and make important for yourselves. The first one is to set boundaries. And this is very important because boundaries are for you. They're not for the person that you're setting boundaries for. They are for you so that you can remain healthy. Does that make sense?
Yes.
So it's not to keep, so I wouldn't set a boundary to keep you to do what I want you to do. It's for me, right? So if I get nervous when people stand too close to me, like my boundary is I would step back to create that space, okay?
Body language.
Yep. And there's lots of just different ways that we can create boundaries, and there's some examples that I can give. So there's a handout on the back as well for you to kind of explore this for yourself. So for example, you notice that your roommate has been eating your food in the fridge. You've never discussed plans to share food, and you don't want them eating what you bought. Mm-hmm. So what is one way that you could approach this roommate to set a boundary around the food that you bought in the fridge? Yeah, so one way you can also respond is to say, I'd like to keep our food separate. Okay, so what if we have shelves in the refrigerator, and everything on the top shelf is yours, everything on the bottom shelf is mine. Please do not take any of the food that's on the bottom shelf. Maybe you can have like community stuff in the door, like ketchup and mustard and things like that, where you guys can kind of share. But establishing what you would like to see, and that's for you, so that you don't run out of food, right? Before you get your next paycheck or your next, the next time you go grocery shopping. Yeah, very good. So setting boundaries with those that we are trying to support is very, very important. Can anybody give me an example of a boundary that you might set with someone who has a substance use disorder that you're trying to support? So sometimes we have to create separation boundaries with certain people because of the things that they ask us for, and that's a great example. Even if they don't like it. Yep, because it's for you, right? It's so that you remain safe, so that you remain on the path that you would like. Perfect. Okay, so the next thing that I want you all to consider is self-care. Now, do you guys know what I mean when I say self-care?
Take showers, stuff like that.
Yes, that's definitely a big part of it, for sure. So I'm sorry I gave you so many handouts, but this can still be helpful. So like I said, I'm a very practical person, and doing these individualized for yourself, I feel like is like the best way to do it. So great. So this document here, and it's on the back table, it has all the different types of self-care. So I'm just going to list the types of self-care that there are. So there's physical self-care, which is what our friend stated, which is things like taking care of your personal hygiene, making sure you're taking showers, that you're eating healthy food, exercising, wearing clothes that are clean and washed and that fit well, getting enough sleep, things like that. So that's our physical self-care, right? So those are the things we need to do every single day to maintain our health, right? Another one is, and you mentioned it, psychological self-care or mental self-care. And so this can be taking breaks from work. This can be participating in things that you enjoy that are not work. So things like hobbies. Maybe you like to paint or you like to go hiking. So different things like that can be really, really helpful for your emotional and your psychological self-care. Another type of self-care is social self-care. So this is when you intentionally spend time with people that you like or that are helpful for you. People that encourage you, where you can have stimulating conversations about topics that you both enjoy and share. This can be really, really good for your own self-care, right? This social connection, doing things that you enjoy. It can be going on a date with your significant other. It can be just spending time asking others for help or providing help to others can be a form of self-care, depending on what it is, of course. Next is also spiritual self-care. So this could be spending time in nature. It could be going to church or to mosque or to pray, doing personal devotions, just going, even sometimes.
Meditating?
Yes, meditating can be one too, yep. Praying, yes, well done. And then lastly is professional self-care. So this is for those of us, for you could say professional or like productive self-care, I like to also call it, because even if you don't have a job, there still could be some things that you do that make you productive, right? So that can be things like being able to say no to new responsibilities. So maybe you're doing really well in all of your responsibilities, and then someone's like, oh, hey, can you add this too? Like, I'm sick of doing this. Like, and being able to say no, I'm good where I'm at. I have enough responsibilities. So being able to do that can be a way to do some professional or productive self-care. Yeah,
So
I think a lot of us
thank you for
can.
reiterating that, because that is very important with
It is.
recovery.
Yes,
Especially
it's
hygiene.
very important.
Especially hygiene.
That too, yeah, absolutely. Another thing could be to learn new things based on what your role is. So maybe it's taking another course to help learn a new skill in your role. Maybe it's taking an actual lunch break. I don't know if any of you are used to working through lunch. I know I do. So actually taking 10, 15 minutes to just have lunch. That's it. Like no charting, no on your phone.
Sometimes having me time is just
Yeah.
what you need, you know?
Mm-hmm.
Time to yourself. You gotta tell people sometimes, especially me, because I live in a large group environment.
For sure.
I have to tell people sometimes, I need me time. Just leave me
Nice.
alone.
Yes, that can be very important for your self-care. Absolutely. So this little assessment thing, I'm just going to briefly explain how to fill it out. So you can go to each of those different sections, and you can rate. In 1 means that you don't do it very well. 2 is I do it okay. Sometimes I do, sometimes I don't. And then 3 is like, I've got this. I shower every day. I exercise as much as I want to. I do everything that I'm good. And then the star is an opportunity for you to, maybe this is an area of self-care that I want to improve in my life, right? So it just gives you kind of an idea of how you can set up maybe your own self-care moving forward, okay? So on the back of the table as well, there is some brochures related to Wedgwood's substance use disorder treatment and mental health counseling services that we have. So feel free to grab one of those. Are there any other questions about anything that we discussed?